Hi, we're going to talk about neck cracking today and even joint cracking. We're going to talk about the idea of what cracking does for the joints and if it's safe. So the first thing I want to talk about is the idea of what a cracking of a joint is, what actually occurs. The technical term is cavitation, and what it refers to is air being forced out of a vacuum under pressure. So each joint in your body is sealed by a capsule of ligaments around it that hold air within the joint. It keeps a pressure within the joint that spaces the joint and allows the joint to move. When a crack occurs, it's usually because the joint has been squeezed in a particular direction and under a particular force that suddenly forces air out of the joint under pressure, and it's actually nitrogen that's been forced out of the joint, and it gives a crack. When the crack occurs, there's a reflex that occurs in the nervous system that then relaxes muscles around the joint as a result of the crack. That's why when you crack your joints, any joint really, in the right direction, it feels good. You get a relaxation of the muscles, and there's often a reduction of any stiffness and tightness, and even a reduction in pain. So there's been some research, albeit spurious research, about the negative effects of cracking joints, and there really isn't any strong evidence to show that cracking a joint does any harm. In fact, there's a classic case of an old scientist who spent 60 years cracking one hand and not cracking the other hand. He'd do this every day. And there's no evidence of any arthritis, any more chances of arthritis in his cracked hand than the other one. Having established that there's no evidence of arthritis from cracking joints, firstly, why do we do it, and why do people worry about other people cracking their joints? So the best reason to explain why we crack our joints and why we get relief from cracking our joints is the reflexive relaxation of muscles that occur around the joint when we take the joint further to its end range. It is a force we can apply to a joint to take it past a stiff point, so it is an effective force, and it can be safely applied to different joints in the body. But one area where it can't be safely applied is the upper neck or the upper cervical spine. And the reason why is in the upper cervical spine there are two vertebral arteries that run through the bones of the vertebra and into the head, and they supply the deep part of the brain called the brainstem. These arteries in normal people can have minor weaknesses in them and are vulnerable to shearing forces when the upper cervical spine is manipulated or cracked. So the risk of causing a vertebral artery leak, or what we call a dissection, is quite high, and there is a lot of evidence to show that after upper cervical spine manipulation, vertebral artery dissection, there's a high risk of that happening. So as physiotherapists and at the Physio Joint here, we do not crack the neck. We crack other joints in the spine. The thoracic spine is a classic example of this because it's a stiff area and it's a safe area to manipulate, and so is the lumbar spine. But the cervical spine, the neck, we don't crack it because of the risk of vertebral artery dissection is too great. And furthermore, we find there are other forces that we apply to the neck, subtle, gentle, sustained forces called mobilization forces that we find are more effective in getting sustained relief of symptoms and improvements in movement. Furthermore, because we can apply these forces in specific angles and directions and in sustained ways, we can subtly move joints that don't tend to move when they're manipulated. We can be far more specific and far more targeted in moving individual facet joints in the cervical spine to get fantastic relief of pain and improvements in movements of the segments of the neck. So in summary, we want you to know that the physiotherapy profession in general, and specifically the Physio Joint, doesn't crack necks. We have specific techniques that are very effective in reducing pain and improving movement at a segmental level in the cervical spine.